Hi, my name is Dianela Velasquez, and I'm going to give a brief overview over measurement validity. According to Glinner, Harman, and Morgan, validity is concerned with establishing evidence for the use of a particular measure or instrument in a particular setting with a particular population for a specific purposes. That is a very complicated way of just trying to say that validity is something that is used to prove that a certain instrument is measuring exactly what it's supposed to be measuring. The way this is done is by establishing evidence. Validity is something that can be very difficult to prove, so like I had previously mentioned, we need evidence to support the validity of a test or a measure. Our book mentions 5 different types of evidence used, which are content, responses, internal structure, relations to other variables, and the consequences of testing. When trying to prove validity, it is important to use as many of these types of evidence mentioned as possible. Like in any situation, each of these types of evidence have drawbacks, which is why using only one type would not be enough proof for validity. Just remember that these are types of evidence, not types of validity. First, we'll go over content evidence. It's about making sure that the content that is in the instrument accurately represents the concept that one is trying to measure. This is done by establishing a clear definition of the concept that the investigator wants to measure. Literature needs to be reviewed to see how this concept is being portrayed in the literature. A way it can be done is by bringing a panel of experts together to review the contents. This alone is not sufficient evidence because it is based on a subjective agreement between experts. I mentioned making sure that the concept is accurately being represented. So say you were trying to measure someone's depression levels. You wouldn't give them an assessment that asks questions like, what is your favorite food or what is your favorite movie, because that doesn't help to measure depression. Next, we have evidence based on response processes. This looks into detail at the responses of the participant and how it matches the construct being measured. Just as a reminder, a construct is a concept that cannot be directly observed, like empathy, depression, or anxiety. You can assume you're observing a construct because of behaviors demonstrated. So, evidence based on response processes is done by asking the participant questions for their reasoning and picking a certain answer. This is done to make sure that they're not just giving answers that are more socially acceptable, or that they're answering without reading the items. Now we have evidence based on relations to other variables, which includes many different categories. The first is test criterion relationships, which includes predictive and concurrent evidence. Predictive evidence is using performance on a certain instrument to predict how someone will do in the future. For example, say you have one of your consumers take the SAT just to see how they would be able to perform in higher education. Now, concurrent evidence is very similar to predictive evidence, but it's a measure of how well a particular instrument correlates with a previously validated measure. Our book also used the SAT as an example, so let's relate this to the same consumer I mentioned earlier. Say your consumer took the SAT and is now a freshman in college. You don't want to wait until your consumer finishes his or her freshman year, so you take a look at their current grades as freshmen and see if their SAT results are correlated with their current performance. If they are, then we have high validity. Then we also have convergent and discriminant evidence. Convergent evidence says that variables that are predicted to have a correlation are in fact related. So let's use two constructs as an example, self-esteem and confidence. Would you say that those two are related? I would say that they are. Now we have discriminant evidence, which says that variables that are predicted to not have a correlation are in fact not related. So let's use two other constructs as an example, intelligence and empathy. Would you say those two are related? I don't think they are as much. Now we have validity generalization, which is applying evidence of validity obtained in a restricted range of circumstances to situations falling outside the range. Validity generalization is about making sure that a scale or whatever instrument you want to use is valid for everyone and not just generalized. Just because it worked for one group, don't assume that it's going to work for everyone. Once we have an instrument or scale that works for everyone, then it's valid. Here I have a picture that says, after my son had his vaccine, he developed autism. Therefore, the vaccine caused autism. That's an example of generalizing because we're making assumptions that the vaccine is to blame just because autism was developed after the vaccine. The last one we have is evidence based on the consequences of testing. There is an expectation that using scores from instruments will produce some sort of benefit as a consequence when it comes to job outcomes or therapy, for example. Validity is proved when there are more positive consequences than bad. Now that I've provided all this information, let me give you a scenario and you tell me whether you think it's valid or not. Say you have a consumer that is wanting to work. You're not sure whether he's ready to go into the workforce or not, so you provide him the PHQ-9 or Patient Health Questionnaire that measures depression. The results show that he has low levels of depression, so you decide that he's ready to work. Does the depression questionnaire accurately measure what we're trying to measure? I would say no, because there are many other factors involved in readiness to work. Although it's important and good information to have, depression levels solely don't give us enough information to be able to determine that a consumer is ready or able to perform at a job. So I would say this gives us low validity. How would you relate validity to the rehab counseling field?